Hi friends, in today's class we will discuss the management of retinitis pigmentosa. In the previous class we have read regarding what is retinitis pigmentosa, the signs, symptoms, inheritance pattern and the atypical RP in its associations. Now we will discuss the management with nutritional supplements, rehabilitation, psychosocial counseling and emerging treatments. So its management is important because it is the most common hereditary cause of blindness in age group of 20 to 60 years. Okay, so we'll read in detail regarding the management options. So coming to nutritional supplements, we have vitamin A supplementation. So it is useful in cases with RHO1 gene mutation. So we have to monitor here vitamin A palmitate is given in the dose of 15,000 international units per day. So we have to monitor for toxicity. So with the help of serum retinol levels and liver enzymes, because it stores the vitamin A. And also if the RP is caused by mutations in the ABCA4 gene, then we have to we should not give vitamin A in these cases, right? So before starting we have to do genotypic analysis also. And also in cases with fundus albipunctaceous, 9-cis beta carotene supplementation is useful. And in some studies they have found that hexaenoic acid supplementation, it is given 1200 milligrams per day in addition to vitamin A is useful. And in some studies omega-3 supplementation is given, and we have to avoid high dose vitamin E in these patients to prolong their vision. In some cases lutein supplementation, it is a xanthophyll, it is given at 12 mg per day or more, so it reduces the oxidative stress. And we have nilvadipine, this is a calcium channel blocker given at 4 mg per day. So it is used for treatment of high BPs and cerebrovascular disorders. So it was able to retard the progression of central visual field defects in RP cases. Okay. Next, coming to the rehabilitative management, we had to provide low vision aids, which in itself is a separate class, but I'll just say in the severe cases these are required. So we can give magnifiers, prism lenses, telescopes, handheld equipment, and along with orientation and mobility training. So they should also be advised regarding nanometer, controlled filtering lenses. So these lenses, they filter the light rays which are phototoxic effects on the retina. So it will up to 550 nanometers frequency is avoided, so that there is increase in the quality of vision. So while they are going in the sunlight, they have to wear this nanometer controlled filtering lenses. These are also called amber spectacles. Then we have to give psychosocial counseling. So it is important because we have several landmarks in this disease, but when it starts, it is progressive. So we have to explain everything to the patient, and we have to provide a counseling to this patient regarding the risk, okay, the disabilities and the visual troubles, and also other supportive groups we have to add to them. Then we have emerging treatments. So in the emerging treatment, we have gene therapy. We have discussed regarding genetic disorders in the eye in our previous class, so do check it once. So here we will discuss how the recessive mutations and dominant mutations will work. So let us take an example. So this is our chromosome. This is a normal one. Now coming to recessive trait. Here what is happening? Okay, so here we are taking a gene and we are showing the normal genes, and instead of that, in recessive, what is happening? It is being replaced with some other gene. So in gene therapy, this is gene supplementation therapy. So here what they'll do, with the help of adeno-associated virus and all, we can add normal gene to these genes. So these are the recessive genes which are already there. So to this we will add the normal gene. Okay, so in that case what will happen? So here we have normal gene, and here in the recessive we are having diseased. So if we supplement it with this, what will happen? So these are not performing gene. These genes are not performing their functions. So we are giving a gene therapy. So we will have one performing one. Okay, so this will do the function. So that's why it can, these autosomal recessive conditions can be replaced by gene supplementation therapy. Whereas if we are coming to autosomal dominant, what these dominant ones will do is that they will attack the normal gene. Okay, so this is going to attack this normal and kill it. So this will not function, this normal gene will not function. So here, if we do this gene therapy, that is gene repair, what will happen? So there is this abnormal gene, there is this normal gene, and there is one more. So this abnormal one is removed, so that is repaired, and it is replaced with the normal one. Okay, so this is gene repair and gene supplementation. So in case of dominant we have to perform a repair, whereas in case of recessive we can do a supplementation. Okay, so this is done usually with the help of adeno-associated viruses. So they carry less than 4.5 kilobytes of DNA, which is actually a very small size. This is gene repair or editing. Then we have a retinal transplantation. So this retina doesn't have synaptic connections with that, so it's not much useful. Then we have stem cell transplantation. So these stem cells, they induce pluripotent cells. These are they become cultured and they get transplanted, so it helps in rejection. Then we have retinal implants. So as we have discussed in our retinal implants class, we have this second site medical products Argus 2 retinal prosthesis. So it has been used in these cases to show usefulness. Now coming to pharmacological therapy with neurotropic factors. So what do these neurotropic factors do? They slow the photoreceptor death, and some they inhibit apoptosis. Okay, so what are these examples? These are brain derived fibroblast growth factor. We have brain derived neurotrophic factor. We have nerve growth factor. We have this fibroblast growth factor, and ciliary neurotropic factor. This ciliary neurotropic factor produced by neural cells is in phase 2 trial. Okay. Then we have inhibitors of apoptosis. X-linked inhibitor of apoptotic protein is the most important and most potent member. Then we have calpain inhibitors, and there is rod derived cone viability factor. So it increases the cone survival. And coming to some miscellaneous things, so it was discovered that hyperbaric oxygen therapy, in few cases this was able to stabilize the disease changes when measured with the perimetric changes. Okay. Examinations. So this was regarding the treatment of this retinitis pigmentosa. So we have nutritional supplementation with vitamin A, DHA, omega-3, lutein, nilvadipine, and rehabilitative management with low vision aids and psychosocial counseling. And the emerging treatment include gene therapy, that is for recessive we have gene supplementation, and for dominant there is gene repair or editing. In retinal and then we have retinal transplantation, stem cell transplant, and retinal implants like Argus 2. Then we have neurotropic factors, that is brain derived neurotropic, nerve growth factor, fibroblast growth factor, and inhibitors of apoptosis and hyperbaric oxygen therapy. So with this we end our class. Thank you.